Hi, I'm Dr. Erica Lewis. So, why do I get to talk to you about ethics? Well, I'm a nurse and a bioethicist, and ethics is an important part of the JMU School of Nursing culture. I'm an expert in ethics by training, and I volunteer on the ethics board at Sentara Rockingham Memorial Hospital. I've previously been a fellow in the JMU Madison Collaborative. You'll hear more about that later. It's part of what makes JMU special. If we work together today, we can accomplish these things. Go ahead and read the slide. It'll take us about 10 minutes to finish this presentation. So, you are a member of a profession that is considered highly ethical by the American public. Why can you benefit from a lecture on ethics? We find that when people become students again, it can be a stressful time, and want to help you prepare for that. The academic rigor of an RN to BSN program brings new challenges. You're likely accustomed to feeling like an expert nurse. Now, some concepts are novel, and you might feel like an imposter. Imposter syndrome is a known problem with nurses who return to school, particularly for their nurse practitioner degree, but also for others. In school, there's times when we discuss an ideal that feels out of line with the realities you're seeing in practice. That can create some tension, some difficulty. Not to mention, you have a life outside of school, and it can be hard to balance it all. You might even think of other things that are new. These new things can make ethical action difficult, but don't feel hopeless. There are things you can do to prepare. Let's look at this case. Please pause this recording and read this true student case. Please answer the questions yourself and then resume the recording. Well, welcome back. There are many elements that make this situation difficult. To name a few, Brandon is experiencing pressure about school. He's frustrated that he fails to see the value in the work he's being asked to do. In addition, his preceptor, someone who should be a legitimate and helpful authority, is encouraging him to do something questionable. Maybe you even thought of other things. So what makes it ethically difficult or complex? The fact that there's an element of right and wrong here is what makes the situation ethically complex instead of practically complex. If Brandon called his clinical instructor, got permission to leave, and then went to his car but couldn't find his keys, he would still have a practical problem, but no longer an ethical one. In an ethics situation, there's an element of right and wrong. So congratulations. By merely identifying the ethical components of a situation, you have illustrated the first step to thriving as a nurse and a student in a complex ethical situation. You'd be surprised how game-changing it can be just to realize that ethics are at play. Try saying out loud in the clinical setting, when it's relevant of course, "Feels like this is an ethics situation," and just see what happens. In addition to recognizing ethical situations, today we'll also learn a method for ethical reasoning. The JMU Madison Collaborative has developed this evidence-based way to help you reason in ethical situations. It involves using 8 key questions to think about the situation. You should know about this because it's part of the JMU fabric. It's also amazing. We get requests to speak about this to major businesses, other schools, and government organizations. You're getting a super basic introduction here. I'm happy to talk more to you about it if it's something you're interested in, or you can look it up on the Madison Collaborative website. Consider trying these questions out in your personal life or in your professional life just to get used to them. You can go ahead and read these, pause the recording if you wish. Take some time to consider how these apply to nurses. I'm going to describe these briefly and include their relation to nursing practice. The very first JMU question is about fairness. With this question, we consider all of the stakeholders and we think about how to balance their needs and interests. Families and patients are our stakeholders as nurses, so are colleagues and the institutions we work for, just to name a few. Next, the outcomes question asks us to consider what long and short-term outcomes might be relevant. You might be wondering if you can think about the fact that there are potentially positive outcomes as a result of a poor moral choice. For example, if I cheat on a test, I might get an A instead of an F. I think that you should name that potential. It is only in naming all of the options, can you also realize that the more likely outcome is that you might get a bump in your grade by a few points by cheating, but that there's also a risk of getting caught and removed from a program of study. So go ahead and name all of the potential outcomes. Remember to include short and long-term outcomes. Next is the responsibilities question, and it asks what duties apply to the situation. As a nurse, we have different or greater obligations to patients than we do towards someone that, let's say, we just met on the street. Our professional obligations are outlined in the American Nurses Association Code of Ethics. We should know those well. It's our commitment to the public. Next, the character question. The character question is my favorite because it allows for the expectations of others to fade away. When you ask this question, you only need to consider how the decision affects who you are. Also gives a certain amount of weight to ethical decisions, recognizing that the actions we choose move us either towards or away being the person we want to be. Next, liberty, also called autonomy. Liberty is one right. You'll see that rights is listed later in the questions as well. We ask about liberty separately because it has special importance to our culture. We're focused on the autonomy of the individual when we ask this question. We think about this greatly in healthcare, but to remember that persons of other cultures may apply this question differently. Other rights include human rights and legal rights. Our patients are often given a patient's bill of rights when they enter our organization. Next, empathy. I also really like this empathy question. As nurses, we just get this, and we have something to teach others about this. It can be game-changing to consider what you would do in a situation if you cared deeply about the person involved. The answers to the other questions sometimes just fade away in light of this consideration. It's a really important question. Next, authority. Authority asks us to consider what legitimate authorities in our lives would do. Part of what made the situation with Brandon so complex was an authority giving him bad advice. If you think that's happening to you, validate the advice you're getting against other authorities. The voice of the group is also more weighty than that of an individual. For example, if you're getting information that feels wrong from a faculty member, consider whether the faculty group supports that view. Okay, that is a lot of information. Don't worry, there is no quiz and you don't have to memorize any of this. In my experience, people to come to the end of asking these questions and they see more nuanced additional options for action. The options just seem clearer. So try them out. Once you're familiar with them, if you get to the end of the question process and are still stuck, consult your clinical ethics board or a mentor. You probably have a tough case on your hands. Tuck these questions away as a potential tool and use them next time something feels difficult. These questions can also serve as verbiage for gently but clearly confronting others when you're concerned about their actions. Perhaps a colleague is speaking negatively about a patient. It might be useful to encourage them to consider the outcomes from that action, or think about how they might feel if the patient was a family member. Try them in that way as well. I'd love to hear how it goes. Okay, thank you so much for listening. Please don't hesitate to reach out to me. I'm the chair of the JMU School of Nursing Ethics Committee. We welcome your involvement in that, and welcome to JMU and best wishes as you begin your educational journey. Thank you. This is Dr. Erica Lewis.